Good evening, everybody. Nice to see your lovely faces. I first want to introduce myself a little bit. I think what is really important for me, I was 5 years old that I knew I wanted to be a doctor. So when I was 18, graduated, I went to university, started studying medicine, and in Holland, I come from the Netherlands. In the Netherlands, it's in the third year of the study, it's 6 years studying for medical degree. In the third year, you go for the first time into the hospital with your white jacket on, and then there is the lung lying, there the appendix, there the asthma, and there the chronic headaches. But the patient, the person who has the disease, wasn't recognized. And my whole dream about how to cure and what cure is fell in 1,000 pieces. And then I decided to stop studying medicine, and in that time I got to know somebody who did homeopathy. And I didn't believe in homeopathy at all at that level. For me it was like putting 2 pills in a swimming pool, stirring it and give 1 teaspoon, and that was it. But he said, come and sit with me and I'll show you what homeopathy is really like. And after that week I was completely caught by the virus called homeopathy. So I started studying in 1981, studying homeopathy and going back to university, also getting my medical degree, because I thought it would be best to have them both integrated. After I was finished as doctor, I went studying with Dr. Alfons Kuijkens, very famous homeopathic doctor in Belgium, and he had a clinic where we, just like you here in the other song, where experienced homeopathic doctors train young people like me in that time. So I learned from him the basic skills, learned repertory from beginning to the end and from back to the end. We had to study every rubric and to really be aware of everything which is in the repertory. After that I went back to the Netherlands, started my own practice and did a lot of teaching all over the world, and studied more, kept on studying, because homeopathy is about learning more and more and more. When you become a homeopath, your studies never end, because it's one of the most beautiful things we have. It never stops and we always learn. So I studied with Rajan Sankaran in his time when he talked about the delusions. I was there very often. I studied with Jan Scholten, who is a colleague from me in the Netherlands, and I studied with Dr. Massimo Mangialavori. It's a homeopathic doctor situated in Italy, from whom I learned a lot too. And since 2003, when I got to know the sensation method, I combine these methods in my practice, because I think we need all the tools there are to really find solutions for our patients. And that's what I want to talk about today. I want to talk about sea remedies, and in this sense, sea remedies, that how we can find them with the sensation method. But sometimes our patients don't go to sensation level, and how we can recognize them then. And to see what we know on the human level from the sea remedies, we see with all the mollusks. So we can combine all these knowledges. And I think one of the best tools to understand the differences between all the methods finding the remedy is what Dr. Shankaran brought us, the 7 levels of experience. Actually, it was his idea, and he asked me to tell you a little bit more about different styles of working and how you can integrate these different styles of working. Because we all know that we never stop learning. Huh? Okay, let's go to the 7 levels. I think you are all well known with these. Huh? I don't have to explain this very much. For me, working with the 7 levels gives you always the information on which way you can, how can I tell it? How you use your information which you get from your patients.